Advanced melanoma patients say news that Medsafe has approved the use of Keytruda alternative, Opdivo, as a positive step towards a melanoma treatment being funded in next month's budget. Currently, the only treatment available for melanoma patients in New Zealand is chemotherapy and radiotherapy, and Pharmac admitted to us in February neither was ideal for treating the disease, particularly when it's metastasised. Last month, petitions with 54,000 signatures were presented to Parliament calling on the government to fund Keytruda, but Pharmac has given that drug a low priority. Catherine Williams was diagnosed with melanoma and given 12 months to live in 2009. She was granted compassionate case access to an immunotherapy vaccine by the Melligan Institute, and she remains in remission 7 years later. Catherine said the registration of Opdivo, or nivolumab as it's also known, is welcome news to terminal melanoma patients.
John, it's great news because Opdivo is a great addition to the registered drugs. I think the main thing today is to keep in mind that melanoma patients across New Zealand are on tender hooks around the decisions for a funded effective treatment in New Zealand. This is great. It's a step in the right direction. And I don't want to diminish the positivity of today. We need to take it that step closer to the government picking up one of these registered drugs and saying, guys, this is what we're going to fund. It's a really, really difficult climate, John. It's an immensely difficult time for melanoma patients, their families and their communities, because we are in this conundrum where we're just waiting and waiting for an announcement from the Minister of Health or our Prime Minister to say we are going to fund effective cancer treatment for melanoma patients, and that's tough. You and I met 7 years ago when I was diagnosed, and I couldn't have imagined that I would be here today to be talking to you about trying to still get something over the line.
There's 2 points that come from that. One, your initial diagnosis was that you were going to die in a very finite period, right? And your continued survival speaks of the immunotherapy treatment you've had. But 2, that you are still waiting for funding of immunotherapy treatments for people in a similar position to the one you were in, 7 years ago?
7 years ago. Look, I acknowledge that when I was diagnosed, none of these treatments were available. But John, in 5 years plus, the research has been done, the drugs have been made, they're on the shelves. Our Commonwealth partners are using the drugs. Patients are presenting to oncology clinics in Australia, in Britain, in Canada. They are receiving these drugs. So I am talking to New Zealanders now and telling them that Keytruda, which you're all well aware of, Opdivo, that was registered yesterday and approved in New Zealand. These are the drugs we are talking about. These are the drugs that melanoma cancer patients are talking about. These are the drugs that we are pleading with the New Zealand government to fund.
Can we look at the 2 forms that are available, Opdivo and Keytruda? Do you understand what the difference is between them, or are they just different brands of the same thing, more or less?
Look, the simplest way to explain it, and I'm really conscious of explaining it so that New Zealanders understand it, Opdivo and Keytruda are drugs which help your immune system to do what your immune system is designed to do. So chemotherapy, radiation, historically, look, those are effective cancer treatments, absolutely. All you need to understand is that they are not effective in treating melanoma. The new generation cancer drugs, which are being used internationally, Professor Antoni Ribas, who attended the Melanoma Summit in 2015 and was on a panel like myself, is absolutely astounded that New Zealand just is not getting it. We're not taking on board that we need to formulate a clinical response. These drugs have arrived. It's not complex. All we need to understand is that the drugs are available. It is achievable that we can get these to cancer patients. Of course it's achievable. It's not easy. It's been tough. It's tough for people like Jonah Wilkins, who, lost her grandson. It's tough for a whole lot of patients and their families, but we will get there. It is the landscape we're on. The new generation cancer drugs are here. They're not going away. Our minister and our PM can continue to say that there are efficacy issues, that there were cost issues. I don't believe that is relative now. The news of Opdivo is fantastic. We had a huge emotional outpouring from patients today, John. It's really, really tough stuff, but we are hopeful. And I am hopeful that we are closer to securing funded, effective cancer treatment for melanoma patients in New Zealand.